So as far as medical treatment goes, personally, I would consider de novo heart failure similarly to acute decompensated heart failure as far as medical treatment goes. It's only the definitive therapies like device therapies where we should be waiting for 3 months. As far as medical treatment is concerned, there is no need to wait for 3 months. You can just stabilize the patient, just like the previous trial, where no IV inotropes are given and no IV diuretics are given. And if patient is stabilized on medical therapy, you can straight away go with the ARNI. So we have small data or large registry. So we have evidence where de novo heart failure was treated with ARNI. So similar to the previous Paramount data, the things were seen on the same trend. There is the composite endpoints were significantly reduced with ARNI therapy as compared to ACE inhibitor or ARBs. So practically all same things are being told in different small studies or small registry data. So in transition study, the results, the early intervention with ARNI should be considered to delay the disease progression in patients with de novo heart failure. Similar to the previous trial where acute decompensated heart failure of acute decompensation of chronic heart failure was treated with ARNI versus enalapril, this absolutely similar results were seen. So if we see the 2021 update to the previous 2017 guidelines, then ARNI has got it is the preferred choice in foundation therapy along with beta blockers and mineralocorticoid receptor antagonist. Because of the new evidence, ARNI is now also recommended in newly diagnosed heart failure, and not only just stable heart failure, also unstable heart failure where patient is stabilized in short time pre-discharge. Clinicians should aim to achieve the optimal therapy within 3 to 6 months of initial diagnosis of heart failure. And the recent new kid in the block was SGLT2 inhibitor, which has shown benefit in patients of renal dysfunction, without renal dysfunction, heart failure with preserved ejection fraction, heart failure with reduced ejection fraction. That is something which new has come with recent guidelines and recent data. The ARNI may be considered as a first-line therapy instead of ACE inhibitor in heart failure with reduced ejection fraction in both stable patients and in unstable patients stabilized in hospital. So I won't go through these lines again and again.